Hi guys, this is Rachel from Healthy Women channel. Thank you for tuning in. We've all been there, that moment of panic when you realize your period is late. But before you start imagining all sorts of worst-case scenarios, know that missed periods are actually pretty common. In fact, there are a number of reasons why your period might be MIA, some more serious than others. So take a deep breath, grab a cup of tea, and keep on watching to learn more. Here are the top reasons you might miss a period. The most common reason for a missed period is pregnancy. If you've been sexually active and have missed a period, taking a pregnancy test is the best way to rule out or confirm pregnancy. When a woman becomes pregnant, her body produces human chorionic gonadotropin, GHCG, a hormone that prevents menstruation from occurring. Before we continue, please consider liking this video and subscribing to our channel for more helpful videos like this. Stress, the ultimate menstrual cycle saboteur. When you're under a lot of stress, your body produces more cortisol, a hormone that can disrupt your normal hormonal balance and cause your period to be delayed. And let's face it, life can be stressful sometimes. Between work, family, and everything else, it's no wonder our bodies sometimes rebel. If you suspect that stress might be the culprit behind your missed period, try some stress-reducing activities like yoga, meditation, or a good old-fashioned bubble bath. And if your period is still MIA after a few months, it might be time to talk to your doctor. Weight changes. Whether you've gained or lost a significant amount of weight, it can throw your menstrual cycle out of whack. This is because your body needs a certain amount of body fat to produce estrogen, a hormone that plays a key role in regulating your period. So if you've lost too much weight, your body might not be producing enough estrogen to trigger ovulation and menstruation. And if you've gained too much weight, your body might be producing too much estrogen, which can also disrupt your cycle. If you suspect that weight changes might be behind your missed period, try to maintain a healthy weight through diet and exercise. And if your period is still missing, talk to your doctor. Birth control. Some forms of birth control, like the pill, patch, or IUD, can cause your period to be lighter or even disappear altogether. This is because these forms of birth control work by regulating your hormones. And in some cases, that can mean suppressing ovulation and menstruation. If you're on birth control and your period is missing, don't panic. This is a common side effect of some types of birth control. However, if you're concerned, it's always a good idea to talk to your doctor. Polycystic ovary syndrome, PCOS. Polycystic ovary syndrome, PCOS, is a condition that affects up to 10% of women of reproductive age. It's caused by a hormonal imbalance that can lead to cysts on the ovaries, irregular periods, and a host of other symptoms. If you have PCOS, your body might be producing too much androgen, a hormone that can interfere with ovulation and menstruation. If you suspect that PCOS might be behind your missed period, it's important to talk to your doctor. They can run tests to determine if you have PCOS and recommend appropriate treatment options. Thyroid problems. Your thyroid gland plays a key role in regulating your metabolism, which in turn can affect your menstrual cycle. If your thyroid gland is underactive, a condition known as hypothyroidism, it can cause your period to be irregular or even stop altogether. If you suspect that thyroid problems might be behind your missed period, talk to your doctor. They can run tests to check your thyroid function and recommend appropriate treatment options. Perimenopause. Perimenopause is the transition to menopause and can cause changes in your menstrual cycle. As you get closer to menopause, you might experience missed periods or shorter or longer periods. If you're over 40 and experiencing changes in your menstrual cycle, talk to your doctor or healthcare provider. Medications. Certain medications can also affect your menstrual cycle. If you're taking any medications and have missed a period or are experiencing irregular periods, talk to your doctor or healthcare provider about the possible side effects of your medication. Excessive exercise. Excessive exercise can also affect your menstrual cycle. If you're an athlete or exercising excessively, you might experience missed periods or irregular periods. This is because excessive exercise can affect your hormone levels. Breastfeeding. If you're breastfeeding, it can also affect your menstrual cycle. Breastfeeding can cause you to miss a period or experience irregular periods. This is because breastfeeding can affect your hormone levels. If you're concerned about your menstrual cycle while breastfeeding, talk to your doctor or healthcare provider. In conclusion, while missed periods are usually nothing to worry about, it's always a good idea to talk to your doctor if you're concerned. They can help you determine the underlying cause of your missed period and recommend appropriate treatment options. And remember, humor can also be a great way to cope with the ups and downs of our menstrual cycles. So don't be afraid to laugh a little. It might just make everything a little bit easier.
Thank you for watching and please subscribe.